Procedural sedation, sedation by RNs. Let's talk about it. This is absolutely my wheelhouse. Advocate Maggie. I was a prior investigator for a board of nursing. Been a legal nurse for 15 years. I have been a nurse for 25 years. Grew up in the ICU. Have done a lot of procedural sedation and spent my master's degree studying it and creating a tool, basically a checklist that could be used by anyone from the scheduler, so an unlicensed person, to a licensed person to decide whether it should be a nurse to sedate or if that person should be on the anesthesia schedule to have them checked out to make sure it is appropriate for RN sedation. And to your point, in the ICU, we would do sedation as well, and ICU nurses used to get procedural or conscious sedation education, because just because you work in the ICU and you can manage a patient with an airway, that has nothing to do with procedural sedation, education, training, and knowledge. No. And we've seen that go wrong, right, folks? I know I have, and no. If you have not had the procedural conscious sedation training, then you don't administer sedation. No. There are rules, regulations. The Board of Nursing has a specific position statement, and I'm just going to use Texas, where it talks about the non-CRNA who is sedating and some of the requirements that have to be met. Now, your organization will also have a policy. For example, Texas has things like you got to monitor the patient, blood pressure, SAT, heart rate, but it does not say end-tidal CO2. Now, if you do procedural sedation, you know that's best practice. You know that's based on science. You would follow your hospital's policy, and the minimum standard per that position statement is, really from the guidance from the American Association of Anesthesia, those bodies that give that education for patients to have the best outcome when giving sedation, and who gives the RN even the ability to give the sedation within the organization. It's under the anesthesia department. We get education through them. That's an extension of them, normally given by a nurse, right? It was the OR actually manager who did my last one, but it's normally given by nurses, but all those policies and everything fall under what anesthesia, right? Those best practices come from their discipline. Sedation, I don't think anyone is shocked about that. The education, the research all comes from their bodies. The American Association of Anesthesia, there's all kinds of literature as it pertains to that, but procedural sedation is very different than a patient in an ICU with a secure airway, or even if they're in the ICU and they don't have a secure airway and they're being sedated. For example, if they have to have, a colonoscopy or, upper, maybe they got a GI bleed, then normally the endo nurse comes up or anesthesia comes up and they're sedated by one of them who have conscious or procedural sedation privileges. And then you can look up in the computer at your organization, because when I float around to different places, I do ask the doctor, who I may or not have worked with, if I can't find them on the computer, that their conscious sedation privileges are up to date, because I can't administer that sedation unless they've met their criteria as well, because it's a non-anesthesia provider giving me instruction to give fentanyl and Versed, more likely than not. That could be the cath lab doctor, the interventional radiologist. It depends on what department you're in, whom is going to be giving the RN the instruction to give the drugs, but they too have to meet the criteria as well per their board and the policy of the organization. So I know that's a lot, but we all have to make sure that we are accountable for our own practices. So great question. I got way long-winded. Like, follow, and share, nurses.